Good evening, ladies and gentlemen. Welcome to yet another interesting health seminar and topic. Today, we're going to be talking about something that's affecting a lot of people. And I remain my humble self, Lucky, aka Dr. Drugs. And as we know, type 2 diabetes is often managed. But is there a reversal? Can it be reversed in such a way that one may be able to enjoy good health without even using medication? I remain my humble self, Lucky, Dr. Drugs, and I'm here to present this in a very simplified form or way that everybody will be able to understand and share the knowledge that we have received today through this online health seminar. Diabetes, management, and reversal. By me, Dr. Drugs. And here is the table of contents. Of course, we can't talk about diabetes, type 2 diabetes, without talking about lifestyle diseases, because it is a lifestyle disease. Then we'll talk about blood sugar and insulin. Then we'll talk about definition of diabetes mellitus. We need to know what we're talking about. Then we need to know about the types of diabetes, the signs and symptoms, causes and risk factors, complications. Then we'll talk about diabetes in relation to one or two other ailments or conditions, etc. and all that. So once again, I remain my humble self, Lucky, Dr. Drugs, presenting this topic on type 2 diabetes management and reversal. I often like to start with this part, which talks about the greatest assassins. And I always emphasize, oftentimes I emphasize that it's not about the type of assassins we find in movies like Mission Impossible and 007. The two greatest assassins on earth today remain cholesterol and stress, and their presence in our bodies is strongly linked towards our lifestyle choices. And today we're talking about a lifestyle disease. So cholesterol deposits that directly or indirectly account for most cardiovascular issues, amongst others, and lead to ischemia, which simply means cell death due to poor blood flow. So they starve of oxygen and food. Stress exerts its own assassination via production of reactive oxidative species that attack DNA, and DNA is in charge of everything about us. So lifestyle diseases, as we know, are linked to one's lifestyle, and they are non-communicable diseases. Examples of such lifestyles include lack of physical activity, poor dieting, alcoholism, smoking, substance abuse, lack of rest, and other lifestyle choices that affect our health badly. So these are a few examples of lifestyle diseases, which include hypertension, cholesterol blockage or atherosclerosis, obesity or being overweight, excessively overweight. Then what we're talking about today, type 2 diabetes, stroke, respiratory ailments, fatty liver disease, heart, high blood cholesterol, heart attack, amongst others. But let us bear in mind that prevention of these lifestyle diseases entail avoiding the avoidable risk factors, because lifestyle diseases are mostly reversible. But guess what? The earlier, the better. Now, what's the relationship between blood sugar and insulin? Blood sugar level is the amount of glucose found in the blood, and a sustained elevation of blood sugar above normal range is simply diabetes mellitus, or simply diabetes. So insulin is a hormone that is secreted in the pancreas by the beta cells, which are also known as the islets of Langerhans. Now, what they do is that they open the gates of the cells of the body, called the receptors, to allow glucose or blood sugar into the cells to produce the energy that we use to function as human beings. So anything that hinders the availability or function of insulin in the body affects the flow of glucose from the blood into the body cells, leading to an excess amount of glucose in the blood, and that is what high blood pressure, high blood sugar. But when this is sustained for a long time, it is called diabetes. Hence, by definition, diabetes is simply a sustained elevated blood sugar level above normal. This elevation of blood sugar leads to a lot of other complications and damage in the body. We'll talk about that shortly. And controlling blood sugar level is important in management of diabetes. Anybody can be diabetic at any time because it's a lifestyle disease. That means even when someone has successfully reversed type 2 diabetes, the person can still have type 2 diabetes if the person exposes himself or herself to what caused it in the first place. And if someone never had type 2 diabetes, had no family member that had type 2 diabetes, that person can have type 2 diabetes if the person exposes himself to the wrong or to the risk factors or wrong lifestyle choices that lead to diabetes. So these are the types of diabetes. We have type 1 or juvenile onset diabetes or insulin dependent. This usually is called juvenile onset diabetes because it's often detected when the patient is younger or is in the childhood, in quotes. And that means that it doesn't mean that we don't have adults that have juvenile onset diabetes, but when it is often detected is when it's in childhood. Now, one peculiar thing about this is that there is no insulin. So in this case, there is virtually no cure. So far, I don't know about the future, but right now, there is no cure for type 1 diabetes because there's no insulin being produced by the pancreas. The islets of Langerhans are not even available. They are not producing insulin at all. Then in type 2 diabetes or adult onset diabetes, this is as a result of insulin being produced but not being recognized by the cells of the body. And that's what we call insulin insensitivity. You understand? And that is the reason why it's possible that one can actually help the cells of the body to recognize this insulin. And then you see that the type 2 diabetes begins to go into remission. We'll talk about this shortly. Now, low amount of insulin or inability of the body to recognize insulin could actually lead to type 2 diabetes. But there's still one more, which happens in pregnant women, which is called gestational diabetes. This happens during pregnancy and is often resolved after parturition or childbirth. The reason why I brought up this pancreatitis is that oftentimes most people just believe that they have diabetes as a result of maybe insulin resistance or insensitivity, or they have one other kind of diabetes or the other. But it is possible for one to have pancreatitis, which is simply the inflammation of the pancreas and can be either acute or chronic. In fact, when some people take excess amount of alcohol, or I'm talking about people that have large amount of alcohol consumption, you can see that they may have an inflamed or enlarged pancreas. And this will eventually lead to what? Shortage of insulin, because the islets of Langerhans in the pancreas are already affected by this inflammation of the pancreas. And then such a person may begin to have signs of diabetes. But bear in mind that if such people are lucky enough to detect that this is as a result of factors I'm going to mention soon, and those factors are removed, they can live a perfectly normal life. A typical example of these factors that can cause this issue are Salmonella species, like the one like typhoid, Aspergillus, Ascaris hepatitis. That's by infection. They will have drugs like antidiabetics. Can you imagine that antidiabetics also can lead to this problem? And then we have others like the statins. These are the ones like the simvastatin and others that are used in management of high blood cholesterol. We have the angiotensin-converting enzyme inhibitors like the lisinopril and others. We have the oral contraceptives, hormone replacement therapy, the diuretics like the hydrochlorothiazide and all that, the antiretrovirals and valproic acid, the ones that are with regards to seizures and all, can actually lead to this problem. And guess what? This is as a result of long-term deposition of toxic metabolites by these drugs. Let's take very close cognizance. Let's take cognizance of this sentence I just made. Long-term deposition of toxic metabolites by these drugs. Now, you see that we're taking drugs to solve one problem without knowing that the metabolites and toxic substances that are deposited as a result of these drugs accumulate in the body up to the extent that it can begin to damage the pancreas. And that's why when I asked some people, I asked some patients a question. because they were enjoying taking all sorts of tablets just to resolve their problem, to come back the next day to take again. I now asked the question. I said, these drugs you are taking, where are they going to? And the patient was as silent as if he didn't have anything to say. I said, you've been taking this thing for years, January to December, and you don't even know what happens to these chemicals in your system. This is an example of what happens to where the chemicals go to. They destroy other things in the body. And maybe one of these days we'll talk about this. But I'm not saying this to deter us from taking these chemical drugs. I will tell us why shortly, why these chemical drugs are important. But we should also understand that reversal of lifestyle diseases is much better than dependence on chemical drugs and chemical substances for treatment. Then trauma too, someone can have an accident or something that will hit the pancreas and damage it. Gallstones, because there's a connection between the exit from the gallbladder, this is what they call the common bile duct. Finally, they meet. There's a point where the ducts from the pancreas meet that from the gallbladder, which is the common bile duct, and then before they get into the small intestine. So anything like gallstones that block that junction will lead to accumulation of substances that will eventually fill all the way back into the pancreas and cause issues. We have other procedures too that can cause all these issues as well. We have endoscopic retrograde cholangiopancreatography, yes, and then we have an acronym to remind us of these factors that cause pancreatitis, and we call get smashed. You can see that will help us to remember this. Now, fatty pancreas or pancreatitis, this affects blood sugar by disrupting insulin production. You know that excess fat are in and around the pancreas itself that produces insulin can actually affect insulin production. And that's why we'll talk about weight management. We should take this seriously. They also reduce insulin sensitivity and also lead to inflammation. Beta cell dysfunction, the cells that actually produce insulin are already losing their functionality, and also impaired glucagon regulation. Glucagon is responsible for letting our body produce or drop more sugar or glucose into the blood. And you can see that when this happens, it further contributes to poor blood sugar balance, or leads to blood sugar imbalances. Now, it's important to note that fat in the pancreas is often associated with obesity, metabolic syndrome, and type 2 diabetes. Maintaining a healthy weight, eating a balanced diet, and engaging in regular physical activity can help reduce pancreatic fat and improve blood sugar control. So we're not even only talking about the fat accumulated all over the body. Even the pancreas itself can have issues with regards to accumulation of excess fat, and that will be the origin of diabetes. Now, what are the symptoms and the signs and symptoms of diabetes? The basic signs and symptoms of diabetes are as a result of excess sugar in the blood, which leads to the body trying to reduce this excess by boiling it through urine. Now, you see, as this sugar is going out through the urine, it's going out with water from the system. And this water is going out with will mean that the person will need to replace that water, leading to excessive thirst. Now, the person is urinating excessively because the body is trying to save itself by removing excess glucose via urine. But the person has to also take back the fluid that has been lost through the urine, and that leads to excessive thirst. And guess what? Because the cells were not even receiving glucose in the first place because of the lack of insulin, then the cells begin to cry out to the brain and say that they are actually hungry, and that will lead to excessive eating. And this is called polyuria, polydipsia, and polyphagia. Now, the signs and symptoms also include headaches, itchy skin, unexplained weight loss or cachexia, which simply means weight loss as a result of long-term disease condition, blurry vision, weakness, mood changes, depression, paresthesia, that's tingling, burning, or painful sensation in the hands and feet, as well as poor wound healing. Okay, but there's one thing we didn't mention here, which is also important, and that is diabetic neuropathy that can actually lead to tingling, burning, and painful sensation in the feet and hands. Now, because of risk factors, I love these cards because it's just a clear depiction of what can cause diabetes, just as it's also a clear depiction of what can cause hypertension. I will tell us the link between diabetes and hypertension shortly. Generally, anything that leads to shortage or absence or loss of beta cells or loss of function of insulin results in diabetes. High blood sugar causes diabetes, and diabetes causes high blood sugar. This is a terrible vicious cycle one must avoid. Please, let's note that generally one can be genetically predisposed to having diabetes. Genetic predisposition is not genetic sentence. That means if one avoids the lifestyle choices that lead to type 2 diabetes, one may have both parents that have diabetes and eventually not even have type 2 diabetes. Type 1 diabetes, which is actually as a result of lack of insulin production, can be caused by trauma and damage. Autoimmune attack, this means the body itself, the white blood cells are attacking the pancreas. Then surgical removal of the pancreas, maybe there was a problem with it and it has to be removed. Certain viruses as aforementioned, and then directly intake of gliadin via a protein called gluten. We find this in abundance in things like the spaghetti, the wheat, and all these other foods like that. Then we have genetic predisposition, as aforementioned, and pancreatitis, which we explained earlier. Type 2 diabetes, there is insulin produced by beta cells, but it's actually an interplay between insufficient insulin and inability of the body to recognize insulin. And that's where it's different. And that's as a result of insulin resistance. Now, risk factors include poor dieting, because excessive sugary beverages and foods will definitely lead to excessive production of insulin, which will stress out the system and also desensitize the receptors of the cells. And obesity, because about 60% or more of patients with type 2 diabetes are overweight. Smoking, alcoholism, pregnancy, as aforementioned, lack of physical activity, because when the muscles of the body move around, it improves their insulin sensitivity and also helps the muscles to pull in glucose from the blood, thereby bringing down the blood glucose level. Aging, as a result of as people get older, there's a reduced ability of the body to carry out its normal metabolic functions, hence there may be excess sugar in the blood. The lack of vitamin D, who knew that? We'll talk about this shortly. And stress, because there's actually stress-induced diabetes. That is as a result of stress hormone, also known as cortisol. We'll talk about that later, how stress can actually lead to diabetes. So diabetes is a disease of diseases. It leads to the manifestation of other diseases and produces lots of free radicals, that's reactive oxidative species. Now, this happens via glucose oxidation that causes more damage. So some cells in the body don't even have the ability to regulate the amount of glucose that goes into them when via insulin. That means they don't even need insulin to allow glucose go in. So as far as there's sugar in the blood, these cells just begin to imbibe glucose into their system. As far as there's glucose in the blood, they just begin to pull it in. That means if we have excess glucose in the blood, then we still pull excess glucose in. And eventually, this glucose will enter into a pathway called the polyol pathway and lead to sorbitol, which does not diffuse out of the cell, but draws in water by osmosis and damage these cells. Example of these cells are those found, that's the retina of the eyes, the kidneys. In the kidneys, they are called the nephrons, the nephrons in the kidneys, and then the nerve cells as well. These cells, that's why you see that people are having people have tingling sensation, burning sensation under their feet, because the sciatic nerve has been attacked by the high blood sugar caused by type 2 diabetes or diabetes. So more specifically, we have diabetic retinopathy, that's damage to the retina of the eyes, diabetic neuropathy, damage to the nerve endings leading to numbness and tingling sensation. We mentioned that earlier. Diabetic nephropathy, which is damage to the kidneys. Then we have high blood cholesterol, because diabetes increases bad cholesterol and decreases good cholesterol, and can also lead to increased peripheral resistance and also lead to what? Hypertension. We'll explain that as well in due course. Then we have cardiovascular diseases, because you know that when you have high level of cholesterol, then cholesterol blockage can lead to ischemia, as aforementioned, which leads to death of the cells as a result of the deprivation of blood flow due to the blockage as a result of cholesterol blockage or atherosclerosis. Lens swelling. Accumulation of glucose in the lens of the eye leads to structural changes that lead to diabetic cataracts. You can see impotence is one of the major things that affect men that have diabetes, as well as infertility. Remember that each sperm cell contains a strand of DNA. And remember, we mentioned that diabetes can lead to what? Damage of DNA as a result of excess free reactive oxygen species or free radical. So you can imagine that from the onset of production of the sperm cell, diabetes has already destroyed the DNA. So the sperm cells that are produced after the period of for production are virtually not good enough to lead to fertilization of the egg. And that's why it leads to infertility, especially in men. It also happens in women because it reduces the viability of the eggs. That means the eggs will be there, but their DNA as well also damaged. It leads to brain damage, of course, via hypertension and stroke, diabetic foot, via damage of blood vessels and nerves, going to the leg, forgetfulness. Remember, cancer is as a result of uncontrolled detrimental replication of cells in the body. And remember that what regulates these cells for replication of cells in the body is actually DNA. So you can see that diabetes has damaged the DNA and has predisposed people to cancer. Of course, arthritis. Can you imagine that diabetes can lead to arthritis and death? The list goes on and on. It's a disease of diseases. The list is almost endless. Now, this is the link between diabetes and hypertension. They often go hand in hand because of atherosclerotic or cholesterol blockage, atherosclerotic plaque or cholesterol blockage caused by the diabetes, leading to an increase in peripheral resistance. Remember that blood pressure is equal to cardiac output times peripheral resistance. Increase in resistance to blood flow leads to compensatory increase in blood pressure by the heart to overcome such resistance to flow, leading to high blood pressure or hypertension. And that is why oftentimes people that have diabetes often have high blood pressure. That's the formula below, where blood pressure is equal to cardiac output times peripheral resistance. So once there's an increase in peripheral resistance, definitely there will be an increase in what? Blood pressure. And that is why some people keep asking, why is that anytime somebody has type 2 diabetes, the person is always having high blood pressure? This is the reason why. So this is why I call the budget, or diabetes, when diabetes wants to read its budget on how it wants to destroy the human body, this is virtually what it is. As you can see, cerebrovascular infarct, hemorrhage, etc., hypertension, nephropathy, and all that. This is how diabetic foot actually comes as a visitor and eventually turns to the landlord and wants to evict the person's leg out of the person's body. And that is how terrible it is. It starts quietly and then begins to lead to what can turn out to be a horror movie. And eventually the leg may need to be cut off. One or two people recently have had issues, popular people like that, and the end was terrible. So now, diagnosis, it's diagnosed by measurement of blood sugar level with the use of what? A glucometer. You can see this guy here is not joking because he is here to measure blood sugar, and he is here to measure blood sugar with the glucometer that you can see on the screen. But bear in mind that the fasting blood sugar, which is blood glucose level after an overnight fast without food, has a normal range of 80 to 100. Please and please and please, it is not 80 or 7, it's not 70 to 125. Because somebody that is selling is a Coke or Fanta may tell you 70 to 125, but it's actually 80 to 100 milligrams per DL. Anything above 100 is diabetes. Now, pre-diabetes is from 100 to 125. Pre-diabetes is just like the John the Baptist to diabetes, the one before the main thing. You understand? So, this point in time, the diabetes is actually reversible. And once it's reversible, the person will go back to normal completely. To be honest, the person never even had any issue with diabetes at all. So that's why it's very important that people take note of this part. Once you just see that the blood sugar level is about 106, 110 and all that, one should begin to make sure it goes back to normal, and you find out that the person may not even have diabetes again ever. The diabetes is when it's from 125 milligrams per DL and above. We also have other ways we can also measure detect diabetes, like 2 hours postprandial, and we also have random blood sugar test. Yes. So about 6 million Nigerians have diabetes, and about 18 million are unaware that they are diabetic. So that means 6 million have and they know, and 18 million have and they don't even know at all. And that's how it is. The statistics of our diabetes is spread, but is mostly prominent in the south of Nigeria. I don't know why, but that's just the way it is. So these are the challenges in management of diabetes: late detection, self-medication, and denial. Because you see, some people say, my father didn't have that, my mother didn't have diabetes. It is not my portion. I reject it. The glucometer is saying that the person is having diabetes, but the person is rejecting it rather than thanking God for revealing what is happening in their body and begin to find solution. They are rejecting. That's called denial. Lack of competent health practitioners. You know that a lot of Nigeria is currently one of the largest exporters of health practitioners, and God knows, God knows who the people that are left, whether they know what they are doing. So save yourself. Now, we have poor health information system because less than 10% of people living with diabetes are adequately educated on the disease. We have lack of adequate health diagnostic infrastructure, poor medical compliance, because often diabetics are on many medications, including those for other diseases like hypertension. Remember, diabetes is the disease of diseases. So as one is treating diabetes, then the Ashebi or the bridal train of the diabetes, one also has to take care of them too. Poor dietary compliance. You tell somebody, please avoid bread, excessive consumption of bread, rice, fufu, cassava, and the person will ask you, so what else will I eat? Because Africans, especially Nigerians, were so used to consumption of carbohydrate that once you just say, don't eat rice, the person will be like, are you talking to me? And you're talking to, and you're the only two in the office. It's only both of you in the office. And because the person doesn't want to hear, he or she doesn't want to hear that he won't eat rice on Sunday. You understand? But unfortunately, you can see that excess consumption of rice can lead to type 2 diabetes or even worsening. Economic issues because of the cost of medication, depression. This makes many patients reluctant to help themselves, and there's one that actually is real and people don't often remember is suicidal tendency. Patients may take their lives, especially after amputation. Now, diabetes is a major risk factor for cardiovascular diseases and eye health issues. You see, diabetes is simply, of course, as we mentioned, sustained elevated blood sugar above normal. This elevation of blood sugar leads to a lot of other complications and damage in the body. Can't even finish talking about them. But controlling blood sugar level, as I've mentioned, is pertinent in management of diabetes. And worthy of note is diabetes leads to an increase in bad cholesterol level that leads to cholesterol blockage, which is called atherosclerotic plaques. And then the blood vessels in the heart and other parts of the body that have been blocked can lead towards cardiovascular diseases. That is the connection. But in the eyes, because the retina of the eyes have no control of how sugar or glucose flows from the blood into them, they can get damaged, as I mentioned, leading to poor vision or loss of vision. Also, cholesterol blockage, the blood vessels of the eyes lead to their damage and cause poor vision as well. Then because diabetes leads to production of free radicals that damage DNA, the cells of the retina begin to malfunction. You can see that is a 3-hit combo, all to the eyes. That's why you see that people that have diabetes are often having eye problems. They find it difficult to read what they could read before, amongst others. So poorly managed diabetes could actually lead to what? Vision loss. This is a healthy eye. You can see the position where you have the retina is all right. But you can see on the other side, look at the way diabetes has damaged the back of the eye, which is responsible for receiving light that is transmitted to the brain for vision. Now, management and reversal of diabetes. This is where I was actually rushing to. Let's take our time and listen to this part because it's very, very important. Now, note that normal blood sugar after 3 to 6 months without medication is an evidence of remission. The moment one can stay for 3 to 6 months without the need for medication, that person is already on his way towards reversal of type 2 diabetes. And the steps include what? Dieting, because you are what you consume. Exercise increases insulin sensitivity. Remember that type 2 diabetes has to do with what? Insulin insensitivity or insulin resistance. Then weight management. I'm going to tell us how weight management worsens or aggravates type 2 diabetes. So one has to stop smoking, avoid alcoholism. Oh, stop smoking, because smoking directly increases the activity of disease species and free radicals and other toxic substances in the system that can cause problems. Discipline is one of the most difficult things in type 2 diabetes reversal, because without discipline, consistency and commitment is a complete waste of time. And the use of orthodox medication to help to get out of danger, that is what they are designed for in type 2 diabetes. They are designed to keep a patient out of danger. That's the best function for them, while the patient tries to use the proper management techniques to reverse type 2 diabetes, which include good lifestyle choices, amongst others. The use of natural pharmaceuticals for effective management and reversal of diabetes. So how does dieting help reverse type 2 diabetes? It helps with weight loss, because reducing body fat, particularly around the abdominal area, can help improve insulin sensitivity and blood sugar control. Remember that the pancreas is where? Around the abdominal area. They also help to improve insulin sensitivity. A healthy diet can increase the body's ability to use insulin effectively. They also reduce what? Glucose intake. It helps to reduce glucose intake, because when you eat the right foods, you find out that your body will not have excess glucose going into the blood. Increased fiber intake also helps with reducing the amount of glucose that is going into the blood as well. Then improving blood lipid profile. Improving blood lipid profile also helps to prevent the issues that come as a result of diabetes. As a result, example include cardiovascular disease conditions. Type 2 diabetes is often associated with inflammation, and hence a good diet will help to reduce this. It also helps to improve gut health, because a healthy diet can promote a balanced gut microbiome, which is important for what? Immune function. Inflammation regulation is also going to get benefit from this, and also an overall metabolic health will also come up as a result of this improved gut health. Then reduce blood pressure as well, because we know that blood pressure and diabetes are virtually like cousins. But let us bear in mind that by making sustainable dietary changes, individuals can improve their overall metabolic health and manage type 2 diabetes effectively. So how does exercise help to reverse type 2 diabetes? It improves insulin sensitivity, increases glucose uptake, that's glucose leaves the blood into the cells for production of energy. It boosts insulin production, enhances mitochondrial function. The mitochondria is just the cell's generator house or energy house or powerhouse. You understand? And then increases muscle mass, because when you have a better muscle mass, you can see that you have more cells drawing out this excess glucose from the blood. And also it improves cardiovascular health, as we all know, by reducing the amount of cholesterol in the system, and also with weight management and all that. And also helps us with regards to cardiovascular health. Reduces inflammation, improves mental health. Of course, we know that stress and anxiety can worsen. In fact, anger worsens diabetes because of the production of what is called catecholamines. Those catecholamines, I'm talking about adrenaline, which leads to excessive production, because once someone is having excess adrenaline in the system, the body pumps in glucose into the blood, and that's not good for diabetes. So anger worsens diabetes. Take note of that. Then an increase in aerobic capacity, because regular exercise improves the body's ability to transport oxygen and glucose to the cells, enhancing the overall metabolic health. That means the body will get better blood supply, and you see that the person begins to function better. But let us know that it is worthy of note that to combine exercise with balanced diet and other lifestyle changes leads to effective management of type 2 diabetes. You have to combine all these things together to have a better result. That's what it's saying. So how does weight loss help to reverse type 2 diabetes? It improves insulin sensitivity, reduces glucose production, increases glucose uptake from the blood, removing glucose from the blood into the cells. Of course, then improves pancreatic function, reduces inflammation, which is often associated with type 2 diabetes, improves blood lipid profile, lowers blood pressure, improves sleep, increases mobility. Because you see that when one is is overweight, they find it difficult to exercise, you see. And when the weight management program comes into play, you find the patient becomes, more, can exercise better. And we know we've talked about how exercise helps with regards to management and or reversal of type 2 diabetes. Then it also reduces medication needs, because weight loss will also help us to reduce medication needs. That means the cost of management of type 2 diabetes will definitely go down, and those toxic substances and side effects as a result of the chemical drugs that people are taking will also be reduced and or mitigated. Now, let us bear in mind that just a moderate weight loss of about 5 to 10% can have a significant benefit for what? Type 2 diabetes reversal. So we hear people talking about fasting, and we don't understand that fasting is not only good for our spirit, but also good for our bodies. So you can see that fasting can help against type 2 diabetes in the following ways. Lower blood sugar level, we know what that does already. Promote weight loss, we talked about that already. Improve insulin sensitivity, reduce the waist circumference, that's automatically reducing the amount of fat, the visceral fat around the abdominal region. Reduces risk of complications like heart disease and nerve damage, can help manage diabetes without medication. Can you imagine? So some people are actually able to, if they could actually reduce what they are eating and undergo what is called a professional intermittent fasting, they may not even need to take the diabetic medication anymore. Improve blood glucose control, reduce the need for insulin, improves overall health and well-being. Now we'll be talking about natural compounds that can help in reversal of type 2 diabetes. We've talked about the chemical compounds, which are essential to take people out of danger. You understand? But we also know that unfortunately their side effects are not so palatable. So you can see that when we have natural compounds that can actually, that can help us with regards to management or reversal of type 2 diabetes, it is better we embrace them strongly because they have no side effects. An example is chromium picolinate, which helps to improve insulin function, improve glycemic control, and reduce glycosylated hemoglobin in the red blood cells. Because you know that the longer glucose stays in the blood, the more it attaches itself to the red blood cells and decreases the ability of those red blood cells to function. And guess what the red blood cells function are or is? Red blood cells function to transport oxygen and food, oxygen to the blood cells and they transport oxygen to the cells of the body and remove carbon dioxide, which is the waste product, away from the cells back to the lungs to be reoxygenated. So you can imagine that when these red blood cells are affected by sugar, their function goes down. That's one of the problems. And chromium picolinate helps to reverse that. Vitamin D, which we take for granted, sunshine vitamin, we often take it for granted because God has made it possible for our skin to produce vitamin D. But sometimes we need a higher dose, especially when one is not exposed to adequate amount of sunlight. Imagine that it improves insulin sensitivity, reduces inflammation, enhances glucose uptake, and supports pancreatic function, and reduces the risk of developing type 2 diabetes at all in the first place. Can you imagine? Then lutein and zeaxanthin helps against diabetic retinopathy because that's the major component of the macula of the retina, which is the very, very sensitive spot in the retina. That's the area that receives the light and sends the signals to the brain to be translated as vision. But that macular area is what I call the 4K area for the clear vision that people have. You can see then coenzyme Q10 that our grandpapas and grandmamas take when they have hypertension is also very important because of type 2 diabetes leads to cardiovascular issues, of which hypertension is one of them. Cobalamin, folate, cobalamin and folate analogs, we have the cyanocobalamin or methylcobalamin, then the folate, that's the B9, and pyridoxine. Also, these help against nerve damage associated with diabetes. The thermogenics are the ones that help to burn fat in weight loss and convert it to energy, and they include the catechins, the pigallocatechins, the capsaicin. We'll see where they are found shortly. And then you can see the hydroxycitric acid, which is also found in Garcinia cambodia, helps to prevent the conversion of carbohydrates to fat. hindering obesity and type 2 diabetes. You can see that. Then we have chlorogenic acid, which helps to hinder the release of glucose into the blood. We have lecithin, which improves insulin function and reduce inflammation, hinders cardiovascular issues, support liver health, and improve glucose usage. So let's just take that. There are so many. So this is just a few. This is just a little part of what these natural substances can do. Now, what are the importance of natural pharmaceuticals in management of and reversal of diabetes? Now, they can help to reverse diabetes completely, especially pre-diabetes. And they help to improve secretion of insulin. They help prevent diabetes in susceptible situations, as aforementioned, attack free radicals that attack DNA, reduce excess glucose in the blood, reverse and prevent damages caused by diabetes in organs like the eyes, the nerves, the kidneys, the heart, the blood vessels, and so on. Weight management. Then they help to resolve erectile dysfunction, because you know that the entanglement factor of a man is very, very, very key, especially with regards to making the owner of the entanglement arena happy. Then they help to resolve infertility caused by diabetes. Remember, I mentioned how diabetes damages DNA, of which we know that the egg and the sperm are virtually possess one strand of DNA. And that means that if that DNA is damaged from the beginning, it's a complete waste of time when the sperm or the egg is fully produced. Now, they help resolve mood disorders associated with diabetes and amputation, amongst others. So I'm not saying that we don't that there are many other things that cannot be done, but these are just a few of the things that these things can do. Now, the products I'm about to show here don't mean that these are the only products that can be used, but these are what I have used for my patients, and I've gotten amazing results. So I'm just trying to give us an example of the kind of products that we can use. And Forever Living products has been available for about half a century, and their products have stood the test of time. And that's why I keep using them, because this is exactly why it's good to have very good products, because over the years, people begin to talk about these products and how effective they are. So let's use these products. Let's show some products that what they contain and relate them to how they can help in reversal of type 2 diabetes. Now, we talked about Promon picolinate earlier, and you can see it's found in these two natural pharmaceuticals. We talked about now aloe vera gel. In fact, the use of these products is numerous. You know, it prevents and reverses organ and tissue damage as a result of diabetes, amongst others, even protecting DNA as a result of type 2 diabetes, among others. We have this one, the good bacteria and the bifidobacteria. Remember, we talked about gut health and type 2 diabetes. Remember, we talked about how fiber is good with regards to helping maintaining good gut health, and also helps to prevent excessive absorption of glucose in the system. So you see that the gut health is also very, very important with regards to type 2 diabetes. So you can see that these good bacteria will actively compete against bad bacteria and boost immune function. Now, this immune function is very essential, because you know that people that have type 2 diabetes often have high blood glucose, and bacteria and other microorganisms love sugar. So you can see that such people need a very sound immune system to be able to attack any bacteria that wants to manifest itself as a result of an injury, and so on and so forth in the system. We talked about vitamin D being very, very important in regards to reversal of type 2 diabetes. Talked about that you can see that's available in the Forever Calcium, because that comes with dicalcium malate, which stays longer in the blood. Talk about chromium, which is also in Nature Min. The immune blend directly improves immunity. This L-arginine here is very important because it leads to the production of what is called nitric oxide. Nitric oxide is a natural vasodilator that improves perfusion of blood to the heart, which is the upstream sector, and also improves blood perfusion to the downstream sector. So the entanglement facility receives better blood supply, and that helps to counter the negative effect of type 2 diabetes, which includes erectile dysfunction. Remember, we talked about diabetes being damaging the eyes, and we also mentioned lutein and zeaxanthin as being very important with regards to eye health. This actually contains lutein and zeaxanthin. That's why taking these at least two daily or two morning, two evening. In fact, people that are already having the signs of diabetic retinopathy I know, or at least one patient that confirmed that the way this thing cleared the diabetic retinopathy was mysterious. Yes. Of course, we mentioned the importance of cyanocobalamin and folate analogs with regards to nerve cell regeneration and rejuvenation. Knowing that type 2 diabetes damages nerve cells directly, consider forever B12 plus is very important. Then we talked about type 2 diabetes being strongly associated or being a cousin of hypertension. And the coenzyme Q10 here takes care of hypertension and also helps to prevent, it also helps to regenerate and rejuvenate the lungs, the kidneys, the liver, and the heart. That means that it's super important with regards to type 2 diabetes and also the cardiovascular issues that are often associated with type 2 diabetes. We talked about lecithin earlier and how it helps with regards to improving insulin function and all that. You find that in there. And also because it contains garlic and thyme, as the name depicts, garlic thyme, it's also very good with regards to DNA stability, amongst others. Diabetes type 2 is often associated with infection and excessive microbial activity because of the high blood glucose level. Now, the bee propolis has very powerful antimicrobial effects, antibacterial, antifungal, and antiviral. You can imagine I gave this product to an HIV couple, and the first thing the man confirmed, the patient confirmed, was that they were sleeping better and there's some issue they were having that was instantly resolving inside because it has antiviral effect. You understand? So it helps with regards to this. Then the aloe blossom herbal tea, you see, it contains chamomile, which is a powerful anxiolytic that calms the mood and effects often associated with high blood sugar. Also contains, which is a potent. Yes, you know that people that have type 2 diabetes are often highly irritable because of the high blood sugar. And this chamomile helps towards calm them down. You understand? And that's also very, very important. Although it also contains aloe vera, which is an adaptogen, an anti-inflammatory and somatic stem cell stimulant to help to rejuvenate and regenerate and rejuvenate damaged blood cells, especially, etc., etc. Now, royal jelly is also known as the fountain of youth, and it helps to regenerate damaged tissue and restore proper nerve and brain function. You know that diabetes also affects the brain, and you can see that this contains a natural neurotransmitter or a precursor to a natural neurotransmitter called choline, which is called acetylcholine. Acetylcholine is a neurotransmitter in the brain, which is very essential for proper brain function because the brain is virtually a ball of nerves floating in fat. That's just a very layman depiction or definition of what the brain is. And that's why, but as a bonus, it also helps to reverse erectile dysfunction. It's often associated with type 2 diabetes. Now, multi-maca. There's somebody that calls it multi-maca. But multi-maca helps resolve erectile dysfunction caused by diabetes, and it's also known as the sex help of the Incas and improves hormonal and sexual function and sexual performance as well. So that's it. You can see that vitalized men and vitalized women helps to reverse hormonal imbalance associated with type 2 diabetes, including sex hormones necessary to battle male and female sexual dysfunction. You see, we'll be talking about the link between obesity and type 2 diabetes. So we can't do without talking about this. You see, this Clean 9 is a 9 days detoxification and weight management program that is designed to reduce caloric intake. Remember, we talked about excess sugar as part of the problem with regards to diabetes, and increase caloric expenditure. Remember, we talked about exercise, you understand, as being very important. Systematically via low caloric diet plan, exercise, and autophagy, therapeutic fasting. Remember, we also talked about the importance of fasting in regards to type 2 diabetes, and natural pharmaceuticals while ensuring adequate nourishment. That is this last statement is the difference between weight management and malnourishment or malnutrition. So people reduce weight via malnourishment and or malnutrition. And that's, yes, the weight may go down, but the cells are shriveled and unhealthy. That's why professional fasting and also use of natural pharmaceuticals and adequate nourishment entails that the cells are just giving off the fat and their integrity and health is maintained. So it also systematically includes intermittent appropriate fasting that helps detoxify the liver. Of course, we've talked about how important this product is. In fact, the functions are numerous, but let's just know that it helps with DNA, to prevent DNA damage, and also helps to detoxify the liver, which is also very important with regards to weight management as well. These ultralights will help to nourish the cells while the fat is leaving and contains the things there. We talked about fiber, how important it is with regards to even type 2 diabetes, but it's also important with regards to weight management because it helps to reduce hunger cravings during the program. We talked about thermogenesis, which is burning of fats to produce energy. That means one gains in two ways. As person is losing weight, person is gaining energy. And we talk about hydroxycitric acid found in Garcinia plus, which hinders the conversion of carbohydrates to fat. Of course, it comes with a measuring tape as an evidence of effectiveness and improvement. So I really thank everybody for waiting, for being patient with regards to this, our seminar so far. But let me leave us with this, as usual. You are what you consume, and there is a constant battle between factors that repair and protect our bodies and those that break it down. So we all have to be what? On the winning side. Thank you so much, everybody, for coming and for listening. So we can see from this our seminar that type 2 diabetes is reversible, but it entails good lifestyle choices and lifestyle changes amongst others, which include exercising and weight management and all that. Good lifestyle choices, actually. And so with this, I'll say thank you all for coming and good night. Bye.